Good morning, everyone. So we are going to start. I guess the rest will be joining this one. We are supposed to have 22 participants in total. So just to introduce myself to you all, for those who doesn't know me, I'm Dr. Nawal Mahajri. I'm psychiatrist, the head of psychosomatic psychiatry unit at Royal Hospital. I'm faculty at Raman Medical Specialty Board and a trainer in clinician-patient communication skills. So I think who's not. I'll try to unmute everyone. Okay, so today we are going to talk about resilience and stress management and the meaning of resilience, what's meant by stress, and is stress always something bad, and how to manage our stress. And in view of COVID-19 pandemic, which is a stressful situation, we are going to focus on resilience and stress management in relation to COVID-19 pandemic. So in this presentation today, I'm going to touch on the following points, and I'm going to talk in more details. COVID-19 phase one, what is it and what we are supposed to do, and in phase two, what we are supposed to do, the meaning of stress and stress management, resilience and emotional strength, what do we mean by that, and how we can empower our resilience and emotional strength, and psychological first aid. So in COVID-19, we went through two phases so far, COVID-19 phase one and COVID-19 phase two. COVID-19 phase one, we were supposed to stay home and stay safe. These are the most important 2 points during the phase one. In phase two, which is the current phase, we are expected to stay safe and to take care of all the precautions we are supposed to take care of. So we are now interacting and leaving our homes. How will life return to normal? What is the new normal? And what do we do now? What do you mean by stress? Stress is a normal psychological and physical reaction to the demands of life. Stress is not always bad. We need some stress in our life, some amount of stress to perform well. So some small amount of stress can be good, motivating you to perform well. For example, we need some amount of stress in order to perform well in exams. We need some amount of stress while we are preparing, for example, for a presentation in order to perform well. The stress becomes more of chronic and starts to affect our life negatively, then this is not acceptable. Then this is the bad stress that we don't need. So the stress management gives you a range of tools to reset your alarm system, and it can help your mind and body adapt, which is the meaning of resilience. Resilience is a way of adapting to the stressors, the new situations in our lives. Without it, your body might always be on high alert, which is not the usual. Usually, we are on high alert whenever we are put in a threatened situation. But what happened with the chronic stress, that this alarm system is always on. Okay, so which is not acceptable, because that will ruin your health in the long term. That will affect your health. That will result in health problems like diabetes, like hypertension, like many other either physical or psychological health problems. So we all agree that COVID-19 pandemic is a stressful situation. So stress during an infectious disease outbreak can sometimes cause the following. Uh, I need to, can you please unmute yourself? There's somebody who unmuted. Okay. So stress during an infectious disease outbreak can sometimes cause the following, which I guess all of us are experiencing it, like fear and worry about your own health and the health of your loved ones, your financial situation or job, and lots of support services you rely on. Many people during this pandemic who has lost their job, who has been experiencing great different stressors in their life, changes in sleep and eating patterns, and this has been revealed by one of the studies we did in here in Oman about the healthcare workers that showed great number of them had sleep and eating patterns issues, difficulty in sleeping, concentration, worsening of the chronic health problems. Those who have chronic health problems, they get worse because of many reasons. One of them is the stress. Second thing is that they're not getting the usual service because of different reasons, because of the lockdown, for example, because of the delay in some of the follow-ups, and so on. Worsening of the mental health conditions, and this is happening. This is like in my clinic, I have seen it, that those who had an issue at the baseline with the mental health, their conditions have started to relapse, their conditions started to get worse. And I have seen somebody who's coming to my clinic for the first time experiencing a new psychological issue or worsening of a baseline psychological issue that they cannot handle anymore. They need professional help, especially the anxiety and depression. It has been increased dramatically during this pandemic. An increase of use of tobacco, alcohol, and other substances. And I have seen this as well, especially in males, because males usually, they don't tend to talk and ventilate about their issues easily like females, so they go to tobacco or maybe alcohol use. So, okay. Trying to move to the next slide. So so how we can manage our stress? We need to take care of our physical health as much as we can. We need to exercise purposeful, mindful attention. We need to identify irrational and negative thoughts and challenges. And those negative thoughts are very important to take care of, because it's always like the way we it affects the way we feel, and at the end it affects the way we behave. So there is a connection between the three, and trying to break this vicious cycle, we need to identify the negative thoughts that affect our feelings and our behavior. Identify the onset of strong emotional response. There are certain triggers that trigger strong emotional response, and especially those which are negative emotional response. We need to identify them to be able to maintain them, or to be able to deal with them in a better way and healthier way with time. And we need to have maintain have a list of things that makes us feeling like a feeling of achievement and enjoyment. And there are sometimes simple things in our life that helps us to feel enjoyed. Okay. So, again, what is the meaning of resilience? The resilience is the capacity to recover quickly from difficulties and toughness. And being resilient does not mean that a person won't experience difficulty or distress. No, it's meaning that you will be experiencing these difficulties and distress in a much better way, in much healthier way, in a way that won't make you feel suffer a lot. So people have to, the people who have suffered major adversity or trauma in their life commonly experience emotional pain and stress, and this is normal. This is normal human reaction to stressors. So building resilience and emotional strength, how you can build resilience and emotional strength, there are different ways that anybody of us and any person of us can build their resilience and emotional strength. Like trying to build your connections. It's very important that you need to continue connecting with people, communicating with people. Don't stop connecting with your loved ones and those who cares for you, those who can listen for you. Foster wellness, find purpose in life, find something that helps you to feel a feeling of achievement. Because you know, anything that helps you to feel achievement as an end result will help you to feel good. I'm sorry, but there's somebody who are not unmuting themselves. I'm trying to unmute. I'm not able to do it from my side for some reason. So please unmute yourself so the rest will be able to hear lecture. Let me try, check. Okay. So you need to find purpose, embrace healthy thoughts. You need to seek help. Don't be tough on yourself. Whenever you need help, you need to seek it either from your friends, from your close relatives, and even sometimes from professionals like psychological professionals. And I have seen that people usually have difficulty in the medical field to ask for help. The reasons that might prevent them from doing that is stigma. One of the reasons, maybe they might feel like they are weak by revealing their psychological stressors. So that's why they're hesitant to come forward to ask for help, and they keep suffering. Pay attention to how you are taking care of yourself, to how you are managing your stressors. Psychological first aid, and I think this is the slide before the last slide, there's something called psychological first aid. And this terminology has been used and very actively used during during crisis situations. And anybody, by the way, anybody can do it by empathetic listening mainly, not only psychologists or psychiatrists. So by psychological first aid, you can help and aid those who are going through tremendous stressors, crises, those who are not yet ready to go through long term kind of psychotherapeutic interventions. And the toolkit for emotional emergencies, it's a toolkit for emotional emergencies, as I said, and usually how you can do it for yourself. So you can do it for yourself by providing for yourself a list of people you can call, those who can listen to you, those who are caring for you, those who are willing to support you. By doing, for example, a journal to write down your feelings, or to draw, for example, a way to vent. Some people, they like to draw in a way to ventilate their negative feelings. By putting sort of positive photograph or statements in your room or at your home. Water, drinking water, swimming if possible, that helps to relax your nerves. Watching, for example, comic videos, or listening to relaxing audio. So there are many ways of trying to relax your nerve, ways to help you to try to relax your nerve and uh, to relieve your stressors. And this is the last slide. I just want to let you know all. There are many initiatives in Oman from like young, active Omani psychologists. They have been doing during this pandemic to support people, to guide them, to help them to deal with their stressors in a better way. And one of them is the Psychological Support Service COVID-19 Response Initiative. In Arabic, it's called Tatamman. And I know those are a group of young Omani psychologists who has started this website during COVID-19 pandemic. And the good news that they started to get questions and to get help from different people, not only in Oman, and also from outside Oman. So I would appreciate if you distribute this message to people there, because there are people who really need help, and it's confidential. They are handling it professionally to provide help to anybody and everybody. And that was the last slide. Thank you for your listening, and if there is any question, I'm ready to answer. Any questions? I unmuted everyone, so you can ask your questions. What are the ways to answer kids at home about COVID-19 deaths? Okay. So, start that I'm not the expert in child psychiatry, I'm an adult psychiatrist, but I think one of the best ways to answer their questions is that the people who doesn't take care of their health, they will end up in kind of bad situation. So that's why we need to be clean most of the time, and to try to avoid going to crowded places. I guess so. Any more questions?
Yes, Doctora, do you hear me? Yes. mentioned before that a lot of patient or the number of patients to this psychologist clinic increased because of this pandemic. What type of fear that they have, and why they come to you or they come to the psycho clinics? So I want to know that what the diagnosis and how you treat them by therapeutic or only like counseling.
Okay. So to start with, yes. Okay. So to start with, so can I answer the question now?
Of course.
Okay. So to start with, as I said, that from my observation and my colleagues' observation, the anxiety and depression, insomnia problems has increased during this pandemic. And not only that, we did here at Royal Hospital a study about the healthcare workers in Oman. So we distributed a questionnaire, tried our best to get the maximum number of healthcare workers in Oman, in private and governmental sectors, to answer about the negative psychological effect of this pandemic on our workers. And more than a third of our healthcare workers are experiencing mood problems in terms of feeling very anxious, depressed, having poor sleep. So these are the cases I'm seeing now. And the issue with COVID-19 that they are scared of the unknown. There is a big part of this pandemic is unknown. It's something uncertain. It's uncertain when it will end. It's uncertain about its complication. Every now and then we hear about new complication. It's uncertain when we will get the vaccine. So the uncertainty itself puts people under huge stress that will end up in anxiety, mainly, and depression. So regarding managing these cases, it depends on the severity. So if the one who is coming with mild symptoms, we can treat them mild to moderate. We can try only the talking kind of therapy, which is psychotherapy. But those who are more than that, more severe cases, we need to come with medications first, and then we need to introduce the psychotherapy intervention for them. I hope that answered your question.
Yes, thank you very much. Thank you, Doctora.
Welcome. Any more questions? No questions? Is there any specific exercises to cope with the stress during this period? You know, any kind of physical exercise, like, for example, simple walking, jogging, it will help to relieve your stress. Not necessarily, I'm not going to guide you to any specific exercise, but even simple walking, it would really help you to stress. Swimming, if you can. I know some people, they have swimming pools at home, so swimming as well is very helpful. Any questions? Okay. So I just wanted to know, was this presentation helpful? Did you learn something new? Is it wise thing to do to share the terrifying news in front of elderly? Okay, I have an issue with this point. I'm always telling people, especially those who come to my clinic, that try, and especially those who are anxious to start with. Um, Thank you, Fatima. She's saying it's very helpful. Okay, so sharing terrifying news and details of COVID-19, how many deaths are today, how many cases are positive, and so on, it won't help those people in a way that it will just make them feel anxious, especially the elderly people, those who are staying at home, those who are already taking precautions. These news won't help them in a good way. These news will make them feel more like stressed, more anxious. So it will affect their life negatively more. So I used to advise my clients that try your best to avoid listening or going behind the details of the COVID-19, because at this stage, we all know what we need about this COVID-19. We all know what are the precautions we need to do. So these details will make you feel more anxious, more stressed, so you don't need that extra stress anymore. And I advise some of them, even if possible, to go out of the WhatsApp groups if during this period, if that's okay, and to just have some boundaries, because we do have a problem in our societies, the Arab societies in general, about the boundaries and putting boundaries. So I ask them politely, tell people that I really don't like to listen or to hear or to share with me through WhatsApp any kind of COVID-19 details. I don't like to hear it, and I would respect your response if you can share with me such details. And I advise them no need to go behind the news, because they are already very anxious and they start to get the treatment from my side. So it's not helpful. My answer, it's not helpful. The big problem is WhatsApp sharing some negative messages. Exactly. So you don't need that. And you can go withdraw yourself from such WhatsApp groups. Of course, you need to do it politely. That I need to be out of all WhatsApp groups if all of them are sharing such bad news for this time, like stay for 2 months or 3 months, and please don't return me back to the WhatsApp group, because I know some people, they do return their colleagues back to their WhatsApp group without taking their consent. Okay. So 10 more minutes for questions. If you have any more questions. Any more questions? What is the best way to withdraw yourself from chatting with family members or friends regarding COVID-19? I mean, trying to set boundaries. In a way, I tell them that I really don't like to hear about this detail. I would love to continue chatting with you in different topics, but if that's difficult for you, you need to, I need to withdraw myself. I'm sorry for that. That's really not helping me. Okay, thank you, Haifa. She's saying the presentation was helpful. Thank you, Fatima Al-Alawi. How do I offer emotional support to friends, family members, or co-workers who have been quarantined? Yeah, can do that. So the psychological help. Let me just unmute people first. So for the psychological help, um, okay, Lubna, thank you. So for the psychological help, there are different levels of psychological help. First, as I said, that you can, as a family member or close friend, or as the head of unit, or the nurse in charge, or the manager, whatever, you can provide it directly to your people. You can listen to them. So empathetic listening, by the way, is magic in providing help. Listening empathetically to your coworkers, to your close relatives, to your friends, it will help to relieve their stress. But if that stress level is high enough to cause them more like kind of moderate to severe psychological reaction, then you can at least guide them and encourage them towards professional psychological help. Like to start with, like the website I just shared with you, you can guide them first to go to this website, and those professionals will guide them and help them. If they need more than that, again, they will guide them to go to have more of a longitudinal kind of psychotherapy, psychiatric intervention. Okay, 4 more minutes. If there is any question, more questions. You are welcome, Huda. You are welcome, Tani. I tried my best to be like to the point, so it won't be boring and it will be clear and simple uh, to everyone. No more questions? I will come, Mariam. Thank you. If you can send us a lecture through emails. Yes, I will, inshallah. I will send it to Jum'a, Mr. Jum'a, and then I'll ask him to forward it to you all. Would you like to get such presentations from time to time regarding the psychological issues and support and different and how to approach different psychological problems? I would appreciate if you send Mr. Jum'a your feedback, and if you want to have such presentations, more of such presentations in the future, you can coordinate through him. Okay then, so I think we are done. There's no more questions, and thank you for attending today, and it was my pleasure to have you all. Inshallah, we'll be meeting in the future in more future presentations and meetings and gatherings. Have a good day and bye-bye.
خلصنا.